Wagner, what are the signs that I would have if I have sleep apnea? What do I need to be looking for?
Sure. Sleep apnea, usually the most common signs are someone who's snoring or is gasping for air at night. Other signs, like daytime signs, would be you're kind of sleepy all the time. You could fall asleep most places. It could be anything from depression to mood swings to irritability and morning headaches. Those are all kind of signs that something might not be right, that you're not getting enough sleep.
Wow. So this is impacting really every aspect of your life, not just physical but emotional and sort of mental health too, right?
Yeah, and especially for your partner as well. I mean, if you're snoring and they're not getting enough sleep, so it's kind of a two-edged sword there. It's getting both of us. So, but personally, this is something that has affected me, and that's kind of why we wanted to get involved at Aspen Dental with sleep dentistry. When I got married, I remember my wife telling me, you're not breathing, you're stopping breathing at night.
How scary.
Yeah. So it took me a long time to finally decide, all right, I need to take care of this. So I did the sleep study test, which spent a night up at the hospital. It wasn't my favorite night I've ever had. Lots of wires, people watching you while you're asleep. It's not the best. I wish we would have known about the home sleep test that we can offer here that is much easier. Right. But it ended up being one of the best decisions I ever made to go and get my sleep apnea treated. Something that has affected my family, so I knew I was probably going to have sleep apnea. And the results of the study was that I was stopping breathing or having an apnea 89 times an hour.
Wow. Now, okay, what would be a normal, if there is anything normal about stopping breathing?
Yeah, normal would be less than 5 an hour. So severe is above 30. So I was at 89. So it's definitely something that once I got it treated, it's changed my life, really. So,
literally, you must have felt the difference between night and day. Pardon the cliche, but you must have. How did it affect you?
Yeah, so after you get used to the treatment, which for me was a CPAP, it kind of took a while for me to start feeling better. Yeah. But over time, I'm not tired. I don't fall asleep like I used to, and I just feel better. Much better.
On the marriage front, he's not snoring anymore, so his wife's just delighted, right?
My wife's happy. That's a happy life.
Happy wife, happy life. That's correct. So we've done the sleep test. You've got the treatment that you needed, and therefore you're passionate about this now because clearly it's impacting people's lives in a negative way, and you're just desperate to get out there and get people help, aren't you?
Yeah, if we would be happy if we could find one person that's got sleep apnea and we could help them get treated. Really, that's our goal, is to help people so that they can live a long, happy life. Right. And if we can do that by identifying those that have sleep apnea and help them get treated, our job's done.
Your job's done. Okay, so Aspen Dental, where are you? How do we get an appointment, and how do we get involved in this process?
Yeah, we're right off 14th North, about 2nd East. You can call us 753-5166 and get an appointment.
Would you mention specifically, would you just do this as part of a general exam, or would you call up and say, actually, I think I may have sleep apnea?
So we do a screening for all patients that come in, along with an oral cancer screening, so it's part of our kind of treatment. So we actually have you fill out some questions about sleep, and people wonder, why are you guys asking me about my night's sleep? So no, we do it to every patient.
Yeah. So now you know why. Dr. Wagner, thank you so much. Get in contact with the guys here at Aspen Dental. They really can help you and really can give you a better quality of life. Thank you very much.
Thank you.